Hello, everyone. Welcome to the Thomas Expert Series, and thank you for joining us today. We're going to get started in just a moment. In the meantime, I would like everyone to make sure their microphones are muted, which it looks like everyone is, so fantastic. Thank you, guys. This expert series will be recorded and placed on demand within 24 hours, so please let your colleagues know how much you enjoyed the presentation today and direct them to the on-demand tab or have them sign up for future talks. To get everyone a little familiar with the chat, I want to see where everyone's tuning in from today. I'm here in New Jersey. Where are you at, Krista?
I am here in sunny, no, I'm just kidding. It's actually very rainy in Chicago.
Nice. So we've got some Colorado, we've got Georgia, Jersey, California, Philly, North Carolina, New York, another California. Awesome. So we got quite a bit all over the place today. Louisiana. All right. Awesome. Thank you, guys. So we're going to go ahead and get started. At this time, I'm going to turn it over to Krista here to talk about blood collection in cell therapy.
Thank you. Yes. Hi, everyone. Thanks so much for joining. My name is Krista. I am a product manager at Soul Millennium here in Chicago, covering blood collection and lab supplies. So today we will be talking about cell therapy as it relates to blood collection. I am going to go off camera just so we don't have any technical difficulties while I am sharing my screen. All right. So as I'm sure most of you know, cell therapy is a treatment in which viable cells are injected into a patient in order to effectuate, some kind of medicinal effect. It's definitely a growing therapy, with new technologies and innovative products. Many different types of cells can be used as a part of cell therapy or treatment for a variety of diseases and conditions. For example, around 60,000 patients with blood cancers in the US each year are receiving cell therapy. Recently, two clinical trials where cell therapy was able to provide more effective results than standard treatments for patients with lymphoma. So it's really no longer a last ditch treatment, and many people today have been treated with cell therapy. There are a few ways to collect the cells for cell therapy, those being blood, tissue, and bone marrow. But like I said, I am the expert in blood collection. So today we'll be focusing on the blood specimen collection. So the way it works typically for cell therapy is we'll remove the blood from the patient to get the cells. Those will be created in a lab and grown to be reinfused into the patient to then attack or bind to those cancer cells, the inflammatory cells, whatever we're really trying to attack, to then provide that medicinal effect for the patient. So there are definitely some challenges when it comes to blood collection as it relates to cell therapy and really whenever you're taking blood specimens. There are 2 million needle stick and sharp related injuries annually. 41% of phlebotomists incur injuries from blood draw procedures every year, and over 1,000 injuries happen daily. So this is definitely something on every facility's mind when it comes to blood collection. So not only is this a challenge for the clinician and possibly the patient, but it's also a problem for the facility as well. There's baseline and follow-up testing, loss of productivity, treatment of personnel. So there's a lot of different factors that go into the safety of blood collection and thinking about how safest we can collect those blood specimens. So when do injuries occur? You can see here that the majority of needle stick injuries happen during and after use. So that's kind of where Soul Millennium comes into play. And what we do is try to provide products that protect the clinician during these times. So our company was created to provide unique safety solutions, definitely keeping the clinician in mind. And these are all products that can be used when collecting blood for cell therapy. So our safety blood collection items include our safety multi-sample needle, our safety butterfly needle, and our spring activated safety pull button blood collection set. So first up is our Soulcare Safety Multi-Sample Needle. This is our version of a straight needle that has a safety mechanism attached. So our safety shield is actually color-coded to match the gauge size. So you can tell which gauge size it is even after the cap has been removed. We actually weld our safety arm onto the needle to minimize any risk of the shield coming off during a blood draw. This also allows the clinician to actually pull the safety arm all the way back for better visibility to the injection site. And because the safety shield is welded on, this also allows the clinician to actually use a hard surface to activate the safety arm in addition to using their thumb. We use a premium rubber, so you're able to do a full panel, and we have universal threading, so you can use any tube holder. And then we have our safety butterfly needle. So this is our butterfly needle. It has a sliding safety mechanism. So you can hold onto the hub and actually pull the tubing back, and the needle will be locked out into place with an audible click. You can do this motion with either one or two hands, so it's really conducive for a lot of different work setups. And again, this does have that premium rubber, so you can do a full panel without the needle becoming dull, and the same universal threading as our safety multi-sample needle. And this is our spring activated SoulGuard safety pull button collection set. So this is actually the second to market spring activated technology. Ours features a larger wing set to better stabilize in vein, and it actually makes it a bit easier to handle upon insertion. Our activation arrows you can see here is oversized, so there's a clear area on where to activate the safety. Um, our pull button also requires about 2 times more activation force. So we minimize the risk of any premature activation of the safety mechanism. And it features, like I said, a pull button instead of a push motion, so that it's actually one fluid motion out of the patient's vein, and it's a little bit more comfortable for the patient and then a little bit more intuitive of a motion for the clinician. So once we've removed the blood from the patient to get those T cells with any of the 3 products I just mentioned, eventually, once those T cells have been created and it's time to infuse them back into the patient, we do have a couple solutions for IV infusion. Those, oops, sorry, those include our butterfly wing and our pull button. We offer those both without the lure adapter. So they can be used for infusion into the patient. And this usually takes 60 to 90 minutes to infuse the CAR T cells, and ours are compatible up to 2 hours. Any questions? I'll stop sharing there and come back on camera in case there are any questions.
Hi, while everyone's getting their questions together, I'm going to show you the environment. Here is the environment. This is the Thomas Expert Series. It lives within the Thomas Center. And you can see Solem's kiosk is the center one. There is a welcome message right here. If you click, you can hear from Solem directly. They are running a drawing item. So if you take their survey, you can be entered into the drawing. And then they have resources, PDFs, web links, and videos for you to take a look at, download, add to your virtual briefcase. They will be up for the remainder of the month. And now I'll turn it back to Krista. I think there might be some questions in the chat.
Thank you, Beth. That we have one question for Alex, I think. So just want to make you aware of that, Alex. What have you seen as the best way to prevent a needle stick? Yeah, that's a great question. So 41% of phlebotomists will have a needle stick injury annually. So having some kind of safety mechanism on the needle and being able to activate in vein are really going to be the most beneficial for protecting against needle stick injury. When done properly, in vein needle retraction can actually reduce the risk of needle stick injury by 80%. So, that's why we've created these products. We've tried to come up with unique solutions to our standard blood collection items to really keep the clinician in mind, to keep them safe, but to keep the products really easy to use and really intuitive for the clinician. Thank you for that question. Let's see. And this one says, so would you say that a customer would need your product during trials? If so, which phase? So I'm assuming you mean which phase of cell therapy. You don't need our product specifically. I'm just here to highlight the ones that we do have for blood collection. And you can use those when collecting blood for cell therapy. So you would use the blood collection products that, I just spoke to in that very first step of cell therapy when you're collecting the blood. So you would collect the blood, with one of the products I mentioned, and then from there you would filter out the cells and, do the rest of the phase of cell therapy. Like I mentioned in the end, if you did want to use an infusion device to infuse the blood back into the patient, we do offer our butterfly needle and our pull button without a lure adapter. So you're able to use those for infusion as well as the last step in cell therapy. Are there a lot of spring activated butterflies in the market? Actually, there are only 2. We're the second to the market and haven't seen any others. So we definitely pride ourselves in the fact that we do have one of these spring activated solutions on the market, and we're essentially able to provide customers the safest way to draw blood.
Hey, Krista, can I just comment on that also? Sorry.
Of course.
So we are the only 2 out there. The other spring activated is the BD push button. So anybody that is using the BD push button would then be interested to use our pull button, as even though the motions are different, the push versus pull, these are currently the only ones on the market, but you will start to see an influx as the patent on the push button expired in October last year. So I know there are people coming to the market to make more spring activated butterflies, which you will start to see. However, you will see more push button spring activated butterflies, as Solem is the only one who patented the pulling motion. And as Krista mentioned, the benefit of having the pulling motion is that it's easier and less discomfort on the patient when you're using the motion to pull the button back versus having to push it while the needle's already in your vein. Sorry.
Absolutely. No, thanks, Alex. That's a great comment. And then we have another question. It says, are most people not using safety needles, thus the high rate of injury? I would say there are a lot of people that are still not using a needle with any kind of safety mechanism. Of course, there is a little bit of a price difference with that safety mechanism. It's, the price of manufacturing it is a little bit higher just because it's more material. But then again, you saw in that one slide, the cost of an injury can be quite high as well. So it's definitely something that each facility needs to, recognize and kind of balance and figure out, what is important to them, and figure out, is the cost of, the small increase in the product worth the cost of injury to the clinician and possibly the patient. Thank you for the question. All right, that looks like I have all in the chat. Happy to answer any more questions if anyone has one.
I forgot to mention that this talk will be on demand tomorrow. And you'll be able to see it in its entirety with all of the other Thomas Experts talks we've had this year. Thanks.